इंडियन काउंसिल ऑफ मेडिकल रिसर्च ने हाल ही में एक रिपोर्ट जारी की है। इसमें बताया गया है कि निमोनिया और यूटीआई जैसी कई बीमारियों के खिलाफ एंटीबायोटिक दवाएं कमजोर साबित हो रही है। हम सभी के लिए यह बहुत ही चिंताजनक है। रिपोर्ट के मुताबिक इसका एक बड़ा कारण लोगों द्वारा बिना सोचे समझे एंटीबायोटिक दवाओं का सेवन है। एंटीबायोटिक ऐसी दवाएं नहीं हैं जिन्हें यूं ही ले लिया जाए। इनका इस्तेमाल डॉक्टर की सलाह से ही करना चाहिए। मैं आप सभी से आग्रह करता हूं कि कृपया अपनी मनमर्जी से दवाओं का इस्तेमाल करने से बचें। एंटीबायोटिक दवाओं के मामले में तो इस बात का ध्यान रखना बहुत जरूरी है। मैं तो यही कहूंगा, मेडिसिन्स के लिए गाइडेंस और एंटीबायोटिक्स के लिए डॉक्टर्स की जरूरत है।
Hi, my name is Dr. Devi Shetty. I'm a heart surgeon by profession. I want to thank our Honorable Prime Minister for creating an awareness about antimicrobial resistance. What is the meaning of antimicrobial resistance? It just means that when you develop a serious infection, none of the antibiotics will be able to treat your problem. Why we landed in this trouble? I have been practicing heart surgery in India for the last 36 years. First 15 years, it was the best period of my life. After any heart operation, however major it was, patients had antibiotics just for 2 days, and then we stopped the antibiotics. Whatever reason, if the patient's condition deteriorated after the surgery, sepsis or infection was never a thought we had in our mind, because infection just wasn't there. In the last 10 years, things have dramatically changed. Today, our greatest fear when we do complex heart surgery, or any surgery for that matter, is infection. The problem is, infection can happen, but most of the common antibiotics we use today, they just simply do not kill the bacteria. Why this happened? This happened because rampant use, I wouldn't say use, rampant abuse of antibiotics. You develop cold and cough, you have a little bit of a fever, you insist on taking antibiotics. So all these bacteria have eaten so much of the antibiotics that today they don't care for the antibiotics. Now you may think, if that is the case, why not we come up with new antibiotics? First thing is, for last few years, there hasn't been a single new antibiotic, because it takes millions of dollars to produce an antibiotic to kill the bacteria. And even if we come up with a new medicine, the way we are consuming antibiotic, in no time that bacteria will become resistant. Now who can help? Only you can help. All you have to do is refrain from taking antibiotic without doctor's prescription, and never demand with the doctor that you want an antibiotic. If the doctor feels that you need antibiotics, they will give you, but you don't insist on it. If you don't, believe me, in the near future, we will run out of all the antibiotics and we will go back to the pre-penicillin era, that was before penicillin was invented. Virtually every patient died following an operation because of the sepsis, because of the infection. We are going in that direction. So My request to all of you is, if it is possible, always avoid taking the antibiotics and never take antibiotic without doctor's prescription. Thank you so much for the patient listening. Thank you.